you do the math, 0.8 seconds is approximately 75 beats per minute, and that's where they come up with that typical number for the cardiac cycle. So this, in fact, will be one cardiac cycle from the time your SA node fires, atria contracts, AV node fires, and ventricle contracts. So that whole cycle produces one heartbeat, 75 of which we have during a minute's time.
So basically, in order from start to finish, it goes the thymus node to the AV node, and you just follow the bundle of
the bundle of his, yeah.
Okay, and then you go down and then it just circles back around?
It circles back down to the Purkinje's, up the walls of the ventricles, boom, contract, and then you start back over.
When somebody has a pacemaker, does it take place at the
SA node? Yeah. If you've got an SA node that perhaps is not firing strong enough, then the AV node will tend to take over and run the show, and that's not usually a good thing because it will run it at a different pace from what the SA node is running the show at. So if somebody has a pacemaker installed, it's probably mimicking the effects of the SA node. How about other questions? Down at the bottom of your page, I wanted to mention to you a couple of defects in this circuitry. You'll notice down there the very first term is an arrhythmia. Arrhythmia typically means that you have some kind of problem with the heart conduction system. The SA node or the AV node are not coordinated perhaps. You may have one working more quickly than the other, but an arrhythmia really is a very generic term for a whole host of problems. And I wanted to share a couple of them with you. AFib is atrial fibrillation. Fibrillation is like a flutter or kind of a quivering, and it's an uncontrolled type of situation, perhaps coming from that SA node. Oftentimes with AFib, you may have heartbeats that run in the hundreds per minute, and you'll notice here that instead of fully producing a contraction where the blood is sent down to the ventricles, they're fluttering almost like a twitch. So they're not really doing their job in expelling the blood to the ventricles. This is a less serious problem. You know, you can shock somebody with the paddles if this continues to be a problem, but oftentimes this will correct itself, perhaps through medication or just through the heart getting back into its own sinus rhythm. VFib, however, is serious business. This is dangerous stuff. And with VFib, this time the ventricles are quivering. They're fluttering like they don't know what to do. So instead of actually fully injecting the blood out of the ventricles, they're kind of fluttering like they're having some twitches going on. The problem is, look how big those ventricles are in comparison to your two atria. They hold a lot more blood, and if they're in there quivering, it doesn't take long for platelets to start doing what? Clotting blood. So if you let that VFib start, then you may end up throwing a blood clot, and if you're in the right ventricle, you're going to throw it where? To the lungs. So VFib is a very dangerous situation. This one requires immediate medical attention, and we're looking here at VFib somewhere in the order of 180 heartbeats per minute. And that's kind of the threshold for saying, well, we got a problem. This has to be acted on immediately, and they can use the paddles to try to sync those ventricles back up. But this is code. You know, this is looking at somebody who's got serious issues. VFib is a very dangerous situation.
How do they diagnose it?
They can, if they've got like a 12-lead EKG set up, I believe one of those leads can probably detect something's going on. So you'd at least be able to see it on the EKG monitor if somebody's hooked up to that kind of thing. What I left for you on page 41 is just a set of diagrams, and I kind of skipped past that one there. But in case you want to go home and practice this whole process, what I started you with in the top left corner is your SA node. So notice that the SA node is firing on that top left picture. After the SA node fires, you'll notice that that nerve impulse travels to both left and right atrium, and they do what? Contract. And they're going to pump their blood down into the ventricles. And notice now our message has reached the AV node. left picture shows that the AV node is now fired. And now you'll notice that that message travels down the bundle of HIF, or the interventricular bundle, down the left and the right bundle branch, and now we're traveling up the walls of those ventricles to the Purkinje fibers. And guess what the last picture shows? Contractions, good. Last right picture there shows contraction of the ventricles.
Interventricular.
You can call it interventricular bundle, or you can call it the bundle of HIF. So right there is your AV node. That little bundle sitting right next to your AV node is called the bundle of HIF, or the interventricular bundle. And then at that point you'll notice that slits into your left and your right bundle branch. Those travel toward the left and the right ventricles, up the walls, hit those Purkinje fibers. And those Purkinje fibers promote in the last picture here a contraction of the ventricles.